people, I want you to know that you could see a chiropractor, and about 3 or 4 adjustments to clear that up.
It's usually a very easy fix. And
Yeah.
that's something that's really bypassed a lot in most of the medical community, because it can be such a minor injury, but it can be so devastating to the patient.
Right.
And a lot of times what people will do is they'll check the organ systems and make sure the lungs are fine, make sure the heart's fine, but they're not looking at the structural alignment. So a lot of times that gets bypassed. People are just taking over-the-counter painkillers or muscle relaxers for this, but it's not affecting the structure where that rib is just popped out of place just really slightly, and it's really affects their daily lives. So let's move on and talk a little bit about, as the snow starts coming, slipping and falling on the ice. We see a lot of times that people, they didn't see the ice, it's on blacktop, so it looks like black ice. They didn't think it was there, and they slipped just a little bit. They either fell down, or a lot of times even worse than when they slipped and fell down is when they almost slipped, but they caught themselves, and they caused more damage to themselves than they may have if they actually fell. They did that little almost slipping and falling
jerk.
dance, and they caused a lot more damage possibly than they would if they fell. So when that happens, when they do the slipping and falling dance and almost fall, a lot of times what can happen is the muscles, they're using a lot of muscles they don't normally use to catch themselves to stay up. So these tiny little muscles, as they tighten up really hard in certain areas, especially where they're paraspinal muscles right around the spine, so muscles they don't use as often, they tighten them really hard. And a lot of times it can cause the vertebrae to slip out of place just a little bit. And we can see here the green light is blinking, normal healthy supply of nerve supply here, no pressure on the spine, no pressure on the nerves, and they just slide out of place just slightly. We cause what we call subluxation. It can cause some irritation or pinching in those nerves. Just like we talked about, they can also have that in the sciatic nerve like we talked about earlier from the near fall and slipping on the ice too, but they can have that in other areas of the body. A lot of times we'll see people get those in their neck, maybe then get numbness tingling on their arms. We can see them get that in other areas of the spine. They go to things that we don't necessarily feel that can affect organ function, the immune system, other things like that.
And one more thing while we're on this nerve being pinched, I want to just talk just for a second. There's 2 things that can happen when those nerves get pinched. There's what's called a compressive lesion, which is where the pressure just actually compresses on the nerve, and that's going to slow down the signals going from the brain to the body and back up to the brain. And then there's another type, which is called a facilitative lesion, where it actually causes the signals to fire off rapidly. So we'll use a muscle, for example. So if the muscle has a compressive pinch on that nerve, well, now the muscle is not going to be getting the right signal. It's not going to be getting enough signal going from the brain to that muscle. So when you go to contract that muscle, it's going to be weak. You're not going to be able to have that full contraction like your brain's telling it to, because the signal's not all getting there. Now, on the other hand, if you have too much signal, now what do you think is going to happen to that muscle? Well, it's going to be contracting when you're not wanting it to. So you have muscle spasms or twitches from that same thing.
Now, a lot of times, too, with those muscle spasms, we have a facilitated compression. We have muscle spasms, and a lot of times, the body will actually try to cause a spasm to protect itself. Kind of like if somebody breaks their finger, right? We put a splint on it. The splint is to prevent it from moving in certain positions. A lot of times, the body will cause a spasm to prevent further damage and further pinching of the nerve tissue, things like that. So a lot of times what people do is they kind of go against the body's natural instinct here, and we go right to the drugstore and we just get an over-the-counter muscle relaxer. Now, not to say there's certainly not a time and a place for it. Absolutely there is. Unfortunately, what people do a lot of times is they cause those muscles to stop spasming or stop tightening up, where they're now protecting, just like that splinter on the finger. And then a lot of times people can cause more damage because they go right back out and they put themselves in the position their body was trying to prevent them from going in the first place.
Right. So if somebody has an injury, their body's restricting them from moving a certain way. They should, if they go out, they can get muscle relaxers or painkillers so they feel better, but then they should rest and let their body heal up.
Let it heal. Most of the time they want to take it so they can go back out and make it to the Christmas party and do other things like that. And of course, got to do what you got to do, got to get where you got to get. But we don't want to over-injure ourselves because of that, because we're now not feeling the problem that is still there. We're just covering it up with over-the-counter prescription medication.
So let's get back to the watching out for the slippery ice. So one thing we can do to help prevent this is make sure all of our walkways and places that we're going to be going to, are salted. But The most common way we see these injuries is when people are in a hurry, when you're rushing, when you're not looking down, when you're letting your body get ahead of your legs, and then it changes your way you're distributing your weight, and that's usually when people have these accidents where it's too late, they slipped and they're going down.
It's hard not to be in a hurry in the holiday season, but it's definitely something we should watch
Yep.
for. And we see countless times where people came in and they did the near slip on the ice or the actual slip on the ice and they landed. If you can grab the other model there, the compression fracture, Doc, and this is another thing we see oftentimes when people do land. Let's say they land right on their bottom, boom, hit right on their sacrum or their tailbone, or they land, they slip from an area and they fall right on their feet too, and they hit really down hard and they cause some compression here. What can happen to the spine is actually tiny little tears and breaks in the bone here. So this is a compression fracture or fracture of broken bone, but it's not what you think of when you hear somebody, let's say they were playing football and they broke their neck and they were paralyzed, or they broke their back and they were paralyzed. Not the type of fracture that will cause a paralyzation or paresthesis, anything like that. What it is just tiny cracks in the vertebrae because it had been compressed down so hard that it caused little teeny breaks here. And again, this is not going to cause the paralysis, but what it will cause is severe amounts of pain. And we see people with intense pain all the time that come in with minor compression fractures in the bones. And they never can heal 100% to what they were beforehand a lot of times. So it's definitely something we want to prevent as much as we can by being careful, watching out for the things like the slip and falls. So that's slipping on the ice. Let's move on and talk a little bit about fender benders. And this time of year we see more of those than ever before too. People slipping and going right off the road, hitting trees, hitting snowbanks, people just spinning their car, and then of course, little fender benders.
Yeah,
Someone's parked a red light, can't quite stop. We see the skid, and of course the bad accidents too. But even these minor accidents, let's talk a little bit about minor accidents and major accidents.
Even in the minor accidents, they've been doing studies on whiplash, and even as slow as 5 miles an hour, 10 miles an hour, you can still cause severe whiplash in your neck, which is a big problem, and it can be very painful, and it can also lead to further problems such as arthritis if left untreated.
Now, I always talk to people about when something's out of alignment, kind of like a car. Let's say the car's out of alignment, tires are going to ball, parts are going to wear out faster. And the same thing happens with the alignment in the body, whether it's from improperly snow shoveling or slipping on falling on the ice or these type of car accidents. We can get alignment issues. When we have alignment issues over time, these joints wear out faster. Now, I take x-rays on people all the time and I show them, you have arthritis in this area of your spine. They say, well, Doc, I'm getting a little older. Of course, I should have a little arthritis now. Well, why would they have arthritis just here, not up here, not down here? If this vertebrae is out of alignment, which you can now see here, it's grinding on the joint, it's irritating on the disc, irritating on the nerve, majorly subluxated, misaligned. Over time, of course, this one is going to wear out faster than the ones that are in perfect, proper alignment. And so a lot of times what we see is people will have things like these fender benders in the winter, and they'll think nothing of it. They won't get their spine checked. They won't do anything about it. They think they were just a little sore or it wasn't too bad, or maybe they were sore for a couple of weeks and it got better. Now here we see someone 10 years after that happened, and now we see the damage that occurred over time. They planted a seed during that accident. Now over time, 10 years later, they started to get scar tissue in the area, major adhesions in the area, and of course, some of the degeneration and the arthritis. Also, as far as the alignment goes, when we have the type of whiplash injury, especially with more of the major whiplash injuries, we can see almost complete reversal of some of the structures of the spine, the curvatures here. We should have normal cervical lordosis, or a curvature arcing backward here in the neck. When we have a major whiplash type injury, the head is thrown forward so aggressively and so hard, we have minor or microscopic tears in all the muscles and the ligaments around the spine. And then they can heal wrong. The spine can be thrown out of position, and now it's arced forward like this. Now, if you guys can try this at home with me, take your hand, hold it up just like a nice curve here, and we'll feel the skin in there. We feel how it's loose and relaxed. If we straighten our hand as far as we can, we'll feel how it's now tight, and it's pulling, and it's stretching. And that's what happens when we lose the curves, whether due to a whiplash-type injury or due to just improper posture over years and years, or all sorts of different type of traumas, minor or macro or major traumas. We can start to lose these curvatures. And when that happens, it's now just like the hand. It's now pulling, stretching. It's tighter on the muscles, the ligaments, but not only the muscles and ligaments around the spine, also on the spine and the spinal cord and the nerves themselves.
Yeah, another thing about losing that curve in your neck that goes along with a whiplash injury is, like we were talking about, that degenerative arthritis. The way that the curve is aligned, it lets the joints sit on top of each other nice and even. And if that curve is straightened out, or even worse, is reversed, it's going to put abnormal amounts of pressure on those structures, and the abnormal pressure is going to cause those joints to wear out at an abnormal rate. And actually, a straightened curve can actually cause the joints to wear out at 2 times the normal rate. Now, if it's worse, if it's reversed, the head's all the way curved forward, it can actually wear out at 4 times the normal rate.
4 times the normal rate. That's amazing how devastating that can be to someone's spine. Most of the time, too, a lot of people don't realize or don't know about it, and they don't get their spine checked, and they have no idea.
Well, if you think about that, 4 times the normal rate of degeneration, that means every 10 years your neck is aging like 40 years. Now, some people might think that sounds crazy, but we see people in the office all the time that, I've seen 20 and 30-year-olds that had,
60, 70-year-old necks.
They look like they have 70-year-old necks because there's so much arthritis and bone spurs and disc degeneration. And at the same time, I've seen people in their, their 70s and 80s who don't have any arthritis.
40-year-old necks,
yeah,
exactly. So let's switch over now. We have a short video clip to show. This is Dr. Billy DeMoss out of California. And it's a little video clip he put together about chiropractic in relation to asthma. He's going to give a few tips about it. And then when we come back, we'll talk more about asthma as it's related to winter, constriction of the bronchioles, and some things we can do chiropractically that can help asthma, as well as what they do in their conventional methods. So let's go ahead and roll the clip.